Just to recap then, the usage of the VEGF receptor tyrosine kinase inhibitors in metastatic renal cell cancer. It's now quite some years, 2005, 2006, when we saw Sunitinib and Sorafenib approved at about the same time for metastatic renal cell. One in the first line and one in previously treated patients that had mainly received interferon. So subsequently we developed other drugs, many of which target the VEGF receptor tyrosine kinase pathway, such as Poziotinib and Axitinib, and then subsequently Cabozantinib more recently, that targets not only the VEGF pathway but also MET and AXL, two other pathways that are important in resistance and also important in specific metastases. MET is thought to be important in bone metastases, for example. So we now have a spectrum of the VEGF TKIs. Which one you pick first is a little bit of a lottery, although Axitinib has not been approved in the first line. There are some data supporting its use. All of the others have very good first line data to some extent, except maybe for Sorafenib. So there's been a selection process. In the last few days, in fact few months, we've had some changes in what we go to as first-line agents with the Immuno-Oncology drugs coming into practice, both with Immuno-Oncology doublets such as CTLA-4 and PD-1 with Nivolumab 3 and Ipilimumab 1, and also some data that will be presented here at ESMO 2018 on the combination of Avelumab and Axitinib being superior for PFS compared to Sunitinib, which is still a standard. In the last day, we've had the announcement that the combination of Pembrolizumab and Axitinib is superior to Sunitinib, both for progression-free survival and overall survival in another phase 3 study that we hope to see presented soon. So the VEGF TKIs are still an intrinsic part of the treatment of renal cell cancer, including first-line therapy. In the future, I think we're going to be combining them with immuno-oncology drugs.